Hi everyone, my name is Hayley Koebel. I'm an RN-BSN student at Columbus State University, and I'm presenting my project. This is for my senior practicum, and it is a project on the effectiveness of the ASQ tool that we do use in the emergency department. I want to analyze effectiveness in suicide prevention, not just in the ED, but also in inpatient, psychiatric, and outpatient facilities. So the purpose of this project was basically because a lot of the population that we serve are behavioral health complaints, and we perform this ASQ on a lot of our patients. So I just wanted to determine, is this effective? Do we need to use this on more of a broad spectrum? And that is the purpose of this project. So the goal that I have in mind is to maximize our mental health assessment. In the department that we work in, we only perform the ASQ on behavioral health patients, which I think could potentially be an issue because based on recommendations for public health, the ASQ should be performed on every patient ranging from ages 10 to 24. So some of you might ask, what is the ASQ? It is the Ask Suicide Screening Questions tool that is used in emergency departments, it's used in outpatient facilities, it is used in psychiatric facilities, and pretty much wherever the pediatric population is served, that's where the ASQ should be utilized. This right here is an example of the ASQ. At our facility, we don't have this actual written version of it. We have it in Epic, which is our electronic documentation system. However, this is just kind of a visual of what the ASQ is. So the initial part of it, there are 4 questions that you ask, and if any of them, if any of the answers to the questions are yes, then you would go on to ask the 5th question. So the question number 1 is, in the past few weeks, have you wished you were dead? So that would be a yes or no answer. And then mind you, when we ask these questions, we ask the parent to step out of the room. So it's a one-on-one with the patient, and we are supposed to read verbatim the question. We are not supposed to alter it or change it in any way. So a lot of the time when we do this assessment, I just look in Epic because it has a word for word rather than this version. So we go to the second question. In the past few weeks, have you felt that you or your family would be better off if you were dead? That's a yes or no answer. Question number 3 is, in the past week, have you been having thoughts about killing yourself? That's yes or no. The 4th question would be, have you ever tried to kill yourself? That would be a yes or no answer. And then if they do say yes, we have to ask them how. And then they would probably go through, if they had a plan of how they would do it, and then we ask them when were you having these thoughts. So the 5th question is, are you having thoughts of killing yourself right now? We would only ask number 5 if any of the first 4 questions were yes. If all of the first 4 questions were no, we would not go to ask number 5. So a little bit of background on the ASQ. The suicide was actually the 3rd leading cause of death between ages 10 through 24 in the past. However, in 2017, it was ranked the 2nd leading cause of death among ages 10 through 24. So the reason that this is such a big deal is because I feel like a lot of the adolescent population isn't being thoroughly assessed. A lot of people aren't being asked these questions, even they are asked if they have psychiatric history. However, if they don't, then they're not asked these questions. So the Joint Commission has put a Sentinel report out because suicide in healthcare facilities is on the rise also. And this is a big issue because when we have children that are in our custody or under our care, we are responsible for them, and safety is the #1 issue. So if we don't know that they're at risk for suicide, how are we supposed to properly treat them and properly keep them safe? This is just a little bit more of why the ASQ is so important, and it's because part of our assessment, part of our head to toe, we think about the physical health of these patients, but a lot of what could be going on could be mental, and I feel like we're not necessarily addressing the whole patient. With proper holistic assessment, many of these deaths could be prevented. with just appropriate assessment, appropriate treatment, and appropriate resources. So if you look at the overall picture, mental health is a big part of what we need to address, and it is obviously a big public health problem, with it being the second leading cause of death in this age group. So this is just a little bit of FYI. The Joint Commission does endorse use of the ASQ toolkit, and part of what the ASQ toolkit is that slide that I showed you with the picture where you go through the 4 questions and then go to question 5. And basically, if you get a positive screen, there's a pathway that you have to follow. So if you did have a positive screen in our healthcare facility, they would be flagged as a red, and they would require immediate, you can't leave the patient, there would have to be one-on-one supervision. If they flagged red, that would mean that they answered yes to any of the 4 questions, and also the 5th question, are you thinking of killing yourself right now? That would be a red in our facility. So the yellow would be if they answered yes to any of the 4 questions, however, they were not currently thinking of killing themselves. So they could have a one-on-one sitter, or they could use video monitoring in that case. So public health recommendations, the American Pediatrics Association actually recommends that every person within age 10 to 24 be screened for suicide. The ASQ can be used for that screening, and it can be used by nurses and non-psychiatric providers. So this is a pretty straightforward assessment. It takes less than 2 minutes to ask these questions. A lot of times the parents do not have an issue with leaving the room in order for these questions to be asked. However, if they do, the ASQ provides scripting that can kind of diffuse the parents, because we all know the parents can be a bit much sometimes. So we have scripting that kind of says, safety is our major concern. This is why we're doing this. But mostly the reason why we get the parents out of the room is because the kid is not going to be as honest if their mom's looking at them, and they're not going to want to disappoint their parents, so they're not going to properly go through the screening. So the question is an ASQ an effective screening tool? And the answer is yes. So there was actually a study conducted in the emergency department, and they used the ASQ to assess for suicide ideation, and 53% of those who were assessed came back for suicide ideation, and they were not even in the emergency department for psychiatric related illness or treatment. Can you go back one? Mm-hmm. So also, the National Institute of Mental Health conducted a study in which 97% of the participants screened positive and answering yes to 1 out of the 4 questions. So them answering yes to 1 out of the 4 is an automatic yellow for us. And then, if they go to the 5th question and they are thinking about killing themselves currently, then they would be a red. But in my mind, that is a very effective way of screening, because had we not asked these questions, we potentially could have had no idea that these people were possibly having suicide ideation. So personally, I think that this is a very important screening tool to use, because if we're not assessing for suicide ideation, I don't think we're doing due diligence to our patients. I don't think we're assessing their overall well-being. And while they're under our care, we're responsible for incidents such as an attempt, or if they are successful under our care, that is, not to throw legal terms in, but that is a huge liability, and that's 100% on us. So professional expectations, I think that professionally, this is something that should be used universally. I don't think that it should only be applied to psychiatric patients, because there are patients who do not have diagnosed psychiatric illness who may be having suicide ideation. And if they're not given the proper resources and the proper treatment, then they may be successful in a suicide attempt. So I think as a nurse and as healthcare providers, we have to be very careful with performing thorough assessments. Even though we may think that someone is not at risk, how do we know if we don't ask? So these are just implications of suicide. There was a Harvard study that was published, and it was just talking about the second victim of suicide, which could be friends or family members, and for every suicide, there are at least 6 people that are affected by the death. And that could be very significant because I know a lot of depression and a lot of other psychiatric symptoms could come about on the second victim that people don't think about, and that causes for even increased utilization of resources. They may need therapy or other resources to get even back to a general level of functioning. So that's why I think it's important to think about implications of suicide, not just on the victim, but the second victims. So financial implications, I don't want to talk too much about money, but there is like a financial side. Healthcare resources are being utilized, lots of them, for care of suicidal patients and patients who are successful. Can you go forward to the next slide? Okay, so the estimated cost of suicide-related hospitalizations is about $8,200, which is a lot, and a lot of times the patients that flag red will be hospitalized. We do not send patients home who have screened positive for suicide ideation. So as you all know, we send them to a psychiatric facility where they'll get an assessment from a psychiatric provider, and then they have to be cleared, they have to be given resources, so they don't just go home. And especially if they have pre-existing medical conditions, like if they came to the hospital to be treated for something other than that, then that adds on to the financial burden. There's one more. So suicide-related deaths, they cause an economic burden widespread in the U.S. of about $50.8 billion. So it's very important to address the concerns, but it's also important to look at the big picture financially. And a lot of resources are designated to this patient population, which is good, but it's important to look at the big picture and the cost. Overall medical cost per suicide is estimated at 1.7 to 2 million for ages 10 through 18. So that's a lot of money, and that's a big financial implication. So my desired outcomes, the reason that I wanted to do this presentation is because I want all of the patient population, just not the psychiatric mental health patients, to receive proper risk assessment. If we don't know what's going on, if we don't ask the questions, we can't properly treat. Secondly, I would like appropriate evaluation after they get the positive screen. So you all know that when we have patients that come in and they screen positive, they get a psychiatric social work consult, and they're evaluated by a social worker in that department. However, I would like for us to have a psychiatric upper level provider to also assess. Thirdly, can you go back for just a second? Overall, I would just like to see decreased suicide rates because as of right now, there's an upward trend. I think from 2015 to 2017, there have been double the episodes of suicide among our youth. So I would like to see those trends decrease, and this is just one of the ways that we can fully assess the patient and get them the proper care that they need. A lot of times, the people who screen positive for suicide ideation, the parents had no idea. And I think that's another part of it, just getting family involved to properly have support for these patients. So this is my conclusion. I just want awareness to be brought upon this issue. I think a lot of people don't know that the young population has such high rates of suicide. I personally did not know until I started working in pediatrics. I had no idea. But the number of patients that we get is so great that I think that we need to make sure that they have the resources that they need. And also, we just opened the behavioral health unit at our department. So in that unit, we have complete lockdown. You know, we have to remove everything harmful out of the room. But I think that if we expand, not just for our behavioral health pod, I think that we need to evaluate all of our medical patients that come in. These are national recommendations to have a universal screening, so I think that we need to provide that in our department. So these are my references. That is it. Thank you all for watching the presentation.